Let's discuss pathology entities that are easy to miss and review strategies to avoid diagnostic errors. This case involves an endocervical polyp from a 55-year-old woman. At low power, the lesion appears as a typical endocervical polyp with edematous stroma. However, upon closer examination, while the surface epithelium is benign, there are clusters of abnormal blue cells within the stroma that raise concern. At higher magnification, these stromal blue cells show that some nuclei are round, others spindle-shaped, and they all have very fine chromatin. These cells have high nuclear to cytoplasmic ratio. Concentration of abnormal cells beneath the surface epithelium, forming a cambium layer, is noted. In addition, myxoid stroma in the center of the polyp containing similar atypical cells. A section from the central portion of the polyp shows abundant myxoid stroma with clearly abnormal stromal cells. The nuclei vary in size and shape, round, polygonal, or spindle, with fine chromatin, mitotic figures, and apoptotic bodies. When compared side by side with the benign endocervical polyp, the differences are striking. Benign stroma shows pale chromatin and smooth nuclear membranes. This case shows nuclear pleomorphism and hyperchromatia. Immunohistochemical stains show that these stromal cells are positive for desmin and show nuclear positivity for myagidum. These findings confirm the diagnosis of embryonal rhabdomyosarcoma, or ERMS. Embryonal rhabdomyosarcoma most commonly occurs in children and adolescents and is extremely rare in adults, with only scattered case reports documented. The morphologic features are distinctive when recognized. Primitive round to spindle tumor cells with fine chromatin and scant cytoplasm. Subepithelial condensation of tumor cells, the cambium layer, is a hallmark feature. Immunoprofile are characteristic. The tumor cells are positive for desmin, myogenin, and MyoD1. The overall 5-year survival rate is approximately 70%, with better outcomes in younger patients. The histologic presentation of embryonal rhabdomyosarcoma can be subtle and easily overlooked. In this picture, we see a uterus section with normal myometrium. The surface endometrium is thin, composed of one single layer, which is normal for pediatric patients. There is a thin layer of blue cells under the endometrium, which can be easily mistaken as normal endometrial stroma. Closer view of the endometrium and underlying blue cells would show disorganized arrangement, but could still be overlooked if we don't pay close attention. Only at higher magnification we can see that these nuclei are piled on each other, too disorganized to be normal. In addition, we can see mitotic figures and apoptotic bodies, what are not normal finding for stromal cells in pediatric patients. Myogenin is positive in these nuclei, confirming the diagnosis of embryonal rhabdomyosarcoma. Some cases show differentiating rhabdomyoblasts with eosinophilic cytoplasm and cross striations, known as strap cells, as shown in this picture. There are 3 subtypes of rhabdomyosarcoma: embryonal, alveolar, and pleomorphic. Here is the table summarizing features of these 3 subtypes. Embryonal is seen predominantly in kids and adolescents. The tumor cells are composed of primitive round and spindle cells, often with myxoid stroma. Molecular changes include somatic mutations in the RAS pathway and NF1 mutations. This variant has the best prognosis out of all 3 subtypes. Alveolar rhabdomyosarcoma is seen in adolescents and young adults. It is composed of small, round blue cells in alveolar growth pattern, with cells in the center of the nest falling apart is the most characteristic growth pattern. About 85% of cases harbor the characteristic PAX3 or PAX7 and FOXL1 fusion gene. Alveolar rhabdomyosarcoma has worse prognosis compared with embryonal rhabdomyosarcoma. In addition, fusion-positive cases are associated with worse prognosis than fusion-negative cases. The third type is pleomorphic rhabdomyosarcoma. These cases are predominantly present in old adults with peak in 60s and 70s years of age. Morphologically, the tumor cells are pleomorphic, often with multinucleated tumor cells in the abundant eosinophilic cytoplasm. Myogenin and MyoD1 are focally positive in tumor cells, but desmin is diffusely positive. The tumor has complex karyotypes, but no recurrent genetic alteration is identified. The prognosis is poorest among these three subtypes, with median survival of less than 8 months. In summary, embryonal rhabdomyosarcoma is exceedingly rare in adults, and its morphologic features can be subtle and easily overlooked. To minimize the risk of misdiagnosis, systemic examination is essential. Each component of the specimen should be carefully evaluated in a systematic manner. For any polyp, the epithelium should be examined first, followed by the stroma. A minimum magnification of 10x should be used to ensure that no significant findings are missed.